I'm going to give you pharmacology related to Alzheimer's disease so that you'll be able to be comfortable when they ask you questions on Alzheimer's. These are some of the pharmacological questions you should expect. Buckle up and let's go. Which prescription is indicated for moderate severe Alzheimer's disease? Once again, best way to answer question from the back. This is one question. But as I answer the question, I want you to stop the video, answer the questions on your own, and then listen to me how I explain it. The keyword is moderate and severe Alzheimer's. So there is different kind. There is a mild, there's a moderate, and a severe. Most of the medication will treat mild and moderate, and then some control moderate to severe. Medication for moderate and severe, really bad Alzheimer's, we use Memantine. This Rivastigmine, Galantamine, and Donepezil, they are all used for mild to moderate Alzheimer's disease. So straightforward, something you have to know. If you know it is easy, is Memantine. Next question. A family of a client with the Alzheimer's disease is being prescribed cholinesterase inhibitor, and they are concerned about the gastrointestinal side effects. How should the nurse rank the list to most GI side effects of the cholinesterase inhibitors when educating the family? A bunch of words. Read the question from the back. So, how should the nurse rank the list to most GI side effect of the cholinesterase inhibitor when educating the family? I don't even have to read the first portion of the question. It's irrelevant. Keyword, which one? Arrange them from the least GI symptoms to the most GI symptoms. That's the buzzword. The content here is Rivastigmine is the most dangerous of all. It has a lot of GI side effects. Therefore, you should want them. The one with the least side effect is Donepezil, and Galantamine is in the middle. Another test-taking strategy, Memantine is not cholinesterase inhibitor. It's an MDNA receptor inhibitor involving glutamine, which involve in destroying cells. It has nothing to do with acetylcholine. That's why we use it for severe form of Alzheimer's disease to prevent further damage of cells. So best answer is that. And if you want to eliminate, Memantine is gone here, and then A2 has Memantine is gone. This is arrangement is not right. So this is the least to the most. Next question. And this is providing teaching to a caregiver of a client with moderate Alzheimer's disease being prescribed galantamine hydrochloride. Which of the following teaching the nurse should include? Select reply. This question is just what to test your knowledge about use of these cholinesterase inhibitor. It's used for mild to moderate, and they want to know about this drug. Content, that's all. You got to go up, titrate it every 4 weeks. If we give you a certain level and it's not working, we go up every 4 weeks. The medication comes in 3 formulations: extended release oral and immediate release. You have to give it with breakfast or dinner, so twice a day. Okay, client will need lab draw to check for the kidney and the liver function because that's how it's cleared. The common side effect is mostly related to a cholinergic effect, nausea, abdominal pain, cramping, and headache. So these are all side effects related to that medication. Next question. Read it from the back. Which teaching the nurse should provide to the caregiver about the medication administration? Which medication administration? Donepezil. That's all. That's the key. I'm not worrying about anything. Patient has mild Alzheimer's, and I'm giving them the Donepezil, and I want to know what I should teach you about the medication. Administer the medication only with food. Test-taking strategy. The word only is never right. It's all or none. That's wrong. There's always a gray area between things. Administer the medication at lunchtime with food or without food. Does this sound like you can eat it with food, drink it, take it with food or without food? Right? Administer the medication in the morning. I can tell you morning is not the best way to give you this medication because of the nausea associated with it. Right? Administer the medication in the evening with food. Right? So this is the caveat. When you look at the medication for Donepezil, the manufacturer will tell you to take it in the evening, okay, with food. But you can take it without food or plus food. When you take it in the evening, you get some vivid dreams and you can sleep. And therefore, the best time to take this medication is in the afternoon, lunchtime, with food or without food. Once again, the medication can be taken in the evening, but it gives you a bunch of GI side effects. Therefore, you better off taking in the afternoon. You can take it with or without food. So B is your right answer. Next question. Which of the following are cholinesterase inhibitor recommended for the treatment of Alzheimer's disease? Once again, keyword. And the buzzword is what? Cholinesterase inhibitor. Cholinesterase inhibitor. Which of these is recommended for Alzheimer's disease? You have to know them. I already told you, Memantine is not. It's NMDA inhibitor, right? Sundowning is the MOAOIs. These are the cholinesterase inhibitor. So this Rivastigmine, Galantamine, and Rivastigmine. Even if you don't know anything they give you with the last name stigmine, it's a cholinesterase inhibitor. These are the three medications. Which of the following a client should avoid when while on Donepezil on Alzheimer's disease? Select or apply. Another content that you have to know. Donepezil is for mild to moderate, right? It has GI side effect. One of the major GI side effects is bleeding, ulceration. Because of that, you should avoid NSAID. You should avoid NSAID. Another problem is this is a cholinesterase inhibitor. It's increasing acetylcholine. You should not take anticholinergic. Diphenhydramine, anticholinergic. Atropine, anticholinergic. Triisophenidil, anticholinergic. Therefore, all of the answers are right. You see, test-taking strategy. So all of the answers are right. You should expect some test-taking strategy like that. I took the key information about the medication and then I set questions about it. So expect that, right? A client with mild Alzheimer's disease is prescribed Donepezil. Which clinical data will cause the nurse to question the prescription? You see what I did? Same questions before. I changed it with the different stem of the question. That's why test-taking strategy is very important. Keywords. Prescribe what? Donepezil. Which one will cause you to what? Question the medication. That means contraindication. I give you the side effect. He has GI side effect. Fine. One of the bad GI side effects, ulceration. And this ulceration is GI, they can have bleeding. And therefore, this is one. Early onset of self-deficit. This is why it's being taken. Therefore, this is not something the nurse should question. The patient has Alzheimer's and they have early onset of self-deficit problem. Frequent wandering. This is also Alzheimer's problem, right? History of constipation. If you have constipation, I give you cholinergic, it's good. It's not contraindication. Therefore, the only thing that is a contraindication is gastric ulcer. So that is the way you should be thinking about these questions. Okay, next question. Same thing. Which response from the nurse is appropriate? Buzzword. Appropriate response. Therefore, you go for the keyword why they says respond. Why do you want, what is the question actually me about respond? Look at it. A daughter of a client with a mild Alzheimer's disease is prescribed what? Rivastigmine. Ask the nurse, the purpose of this medication. That's all. Keyword, purpose. You have Alzheimer's disease. What is the purpose? If I'm giving you a medication, I have to target the pathophysiology of your disease. What is Alzheimer's? There's a decrease in acetylcholine. Therefore, if I'm giving you rivastigmine, as you can see, look at it. Stigmines are all cholinesterase inhibitors. I'm going to increase your acetylcholine. That will help with your cognitive function. Therefore, this is your right answer. It does not decrease it. It does not involve with glutamine, and it's not MOIs. That's how you answer questions. Just go with the pathophysiology in the buzzword. Next question. What does it say? Which assessment finding indicate therapeutic effect of the medication? That's all. Assessment finding indicate therapeutic indication. So I'm looking for therapeutic. That means the reason why I give you the medication is doing its job. What is the problem? I have moderate Alzheimer's disease patient for 6 months. He's been taking Memantine. You know, Memantine is used for severe, moderate to severe. And what is this used for? Is Alzheimer's, he has to be cognitive function. It's not only cognitive function. Whatever happened to Alzheimer's disease patient, if there's improvement, yeah, Memantine is doing it. Remember, this does not cure the disease, right? So let's go. Therapeutic means good thing. Frequent headache is an adverse effect, side effect, common side effect. So this is not therapeutic. Rapid improvement in memory, thinking, and language. Yeah, that's cognitive function, but it does not involve in rapid. It slowly get better. It decreases the progression of the disease process and maintain it. Therefore, this is wrong. Client has a minimum level of response to frustration. This is confusing, but that's the right answer. Look at it. Client has minimal level of response to frustrating situation. They have neuropsychotic agitation because they confused and they couldn't remember things. They get agitated and small things. They get mad, they get depressed, and they get frustrated and will be hallucinating. If the frustrating situation does not bother them, that means they're doing good. They know reality now, and therefore, Memantine is doing its job. Diminished ability to perform self-care means they're getting worse. They cannot take care of themselves. Memantine is not working. Therefore, this is the right answer. And next care for a client with Alzheimer's disease experiencing Sundowning. Which intervention is appropriate? Select or apply. Go for the buzzword. Buzzword is Sundowning. Sundowning usually happen when you admit them, and because they don't see day and light, their circadian rhythm get into trouble, and they wake up in the evening, wander around, get agitated, they get confused. Therefore, what do you want to do? Don't restrain them. Okay? Don't ensure strict rule of wandering. They're going to do that. They sound down it, rearrange to their environment so that they know where they are, right? Listen to their concern. Why are they agitated? Identify the source of their fear, right? Provide some safety, and of course, make sure the blinds are up during the day. They can see outside and it's light, and during the night, blinds are down so that they can sleep. Exposure to sunlight. Which information the nurse should convey to the family about what? A client prescribed Donepezil and Rivastigmine for moderate Alzheimer's disease. Both of them are used for Alzheimer's. What would you tell them? The medication will cure the disease. It does not cure it. The medication will stop the progression of the disease. It does not stop it. The medication will prevent the disease from occurring. Disease already occurring. It cannot prevent it. The sticking strategy is this: the medication will slow down the progression of the disease. That is what all these Alzheimer's disease medication are designed for. And the last one, and then just providing discharge teaching to a client prescribed Memantine for moderate Alzheimer's disease, which antacid the nurse should instruct the client to avoid. Remember, antacid is bad, but there's different kind of antacid. Those who take Memantine should not take antacid, that's sodium carbonate. There is antacid related to magnesium oxide, calcium carbonate, aluminum oxide. All of them have side effect. They have specific side effect. Check my GI lectures. I'll talk about the side effect of this anti-acid. But for Memantine specifically, sodium bicarbonate should be avoided. It decreases effectiveness. This is the end of it. Thank you for watching Pharmacology for Alzheimer's. Hope you learned something. Keep charging as always. Best of luck. Bye.